reports.
2014 started out with undercurrents of dissatisfaction in the health sector, carried over from the previous year. Health workers, under the aegis of Joint Health Workers Union, were the first to go on a 3-day warning strike, protesting what they called discrimination by the federal government. Resident doctors nationwide followed suit on June the 1st, demanding payment of outstanding salaries and functionality of the residency training program, among other things. These became full-fledged industrial action on July the 1st for all doctors in public service and November 12th for the health workers, leaving in their wake some very dissatisfied patients.
He will just come and let us know that we should just go, that doctors are on strike. So we are just here.
They gave us notice that they have discharged us, that they cannot do the work alone. That without the nurses, they cannot do the work alone. And since then, no care, nothing.
In mid-August, the government suspended the residency training program, relieving about 16,000 resident doctors of their jobs.
Great Nigerian doctors!
They said this was for appraisal of the challenges in the sector. 2 weeks later, the strike was called off and the program reinstated. In late July, the ravaging Ebola virus disease, which had taken hold in the 3 West African countries of Guinea, Liberia, and Sierra Leone, was imported into Nigeria by now well-known Patrick Sawyer when he traveled into Lagos sick. At the time, doctors in public hospitals were on strike, and the problem landed on the lap of a private hospital, First Consultants. That outbreak cost the nation 7 Nigerian lives, 4 of which came from First Consultants Hospital. Among them, the late Dr. Ameyo Adadevo, who courageously resisted pressure to release the contagious index case. 12 others were rescued from death's door.
It's a tribute to the professionalism of Nigerians, the patriotism, and our ability to collaborate with other agencies. That's what did it.
On the 20th of October, the World Health Organization declared Nigeria Ebola-free.
WHO officially declares that Nigeria is now free of Ebola virus transmission.
Also in October, the Minister of Health, Professor Onyebuchi Chukwu, resigned to run for governor in Ebonyi State. Dr. Kaliru Al-Hassan took over as supervising Minister of Health. The year also witnessed a decline in the numbers of wild poliovirus cases in the country to 6, down from 50 in 2013. Another high point in the health sector was the signing of the National Health Bill into law by President Goodluck Jonathan in late November.
Preventive health care will become the approach. Today, under the National Health Act, the National Council on Health has gone beyond a mere advisory body. It has become the highest policy-making body in the health sector in Nigeria, by law.
Even though 2014 did not see the end to rivalries and complaints in the health sector, there were a few laudable events, one of which was the dispatch of 250 trained Nigerian volunteers in early December to help the effort against the Ebola virus disease in affected West African nations.